All right, let's talk about a condition that, for a lot of people, hides in plain sight. It's a silent warning your body might be sending about a much deeper and way more dangerous problem.
I mean, really think about that for a second. That little ache you get after a walk, the one you just brush off, or that cramp you figure is just part of getting older. What if it's not just a tired muscle? What if it's a huge flashing warning sign from your heart?
200 million. That's how many people around the globe are estimated to be living with something called peripheral arterial disease, or PAD. That is a staggering number, especially for a condition most of us have never even heard of. So what exactly is PAD? Well, the easiest way to think about it is like clogged pipes in your body's plumbing. It's when plaque builds up and hardens in the arteries, but not in the heart, in the periphery, the vessels that are further out. For this explainer, we're going to focus on the legs because that's where it usually shows up first. And look, this isn't just a problem in one corner of the world. It is a massive, hidden, global issue. And what makes it so incredibly dangerous is just how often it flies completely under the radar. Now, what the data shows us is pretty eye-opening. While PAD hits every country, a whopping 70% of cases are in low and middle-income countries. And the growth rate there is just exploding. It jumped by almost 30% in just a decade. This thing is quickly turning into a global health crisis. So that leads to the big question, right? Who needs to be paying attention to this? Understanding the risk factors is absolutely the first step in spotting the danger. And the sources we dug into are crystal clear. Yeah, things like high blood pressure and cholesterol matter, but the big three predictors are age, smoking, and diabetes. Once you hit 50, your risk starts to climb dramatically. And if you smoke or have diabetes, your risk can multiply by up to 4 times. And this chart? Wow, it really drives the point home. If you're a current smoker, you are almost 3 times more likely to get PAD. If you have diabetes, you're more than twice as likely. These aren't just small bumps in risk, they are absolute game changers. Okay, so let's follow the journey of how this disease actually plays out for a person, because this is where it really earns its reputation as a silent threat. And here's the crazy part. Most people who have PAD feel absolutely nothing, 0 symptoms. Their pipes are getting clogged, but no alarms are going off. Maybe they're not very active, or maybe their body has cleverly created tiny new blood vessels to bypass the blockage. But you gotta remember, the disease is still there and it's getting worse. Now, when symptoms do show up, the classic sign is something called intermittent claudication. And it's a really specific kind of pain. It's a cramp, an ache, usually in your calf, that shows up like clockwork when you walk, and then it vanishes when you stop to rest. What's happening? Your muscles are literally starving for oxygen when you move, and that pain is them screaming for help. And this is maybe the most important message we have. Check out this chart. Whether you feel that pain or not, the danger is very, very real. Even with 0 symptoms, just having PAD means your risk of dying from any cause goes up by 50%. And if you do have symptoms, that risk doubles. The leg pain is just the messenger. The disease itself is the real killer. Unfortunately, for some people, the disease keeps progressing. It moves past silence, past that on and off pain, and becomes a constant, severe threat. This stage is called chronic limb-threatening ischemia, or CLTI. And it means exactly what it sounds like. The pipes are so clogged that your leg and foot aren't getting enough blood even when you're just sitting on the couch. The telltale signs are pain in your foot even when you're resting, or sores and ulcers that just refuse to heal. And the outlook here, honestly, it's grim. If a person with CLTI doesn't get treatment to restore blood flow, they have a 22% chance of dying within a year. They also have an equal 22% chance of needing a major amputation, like losing their leg. These numbers are just devastating. So this brings us to the final and I think the most critical takeaway from all this. We've spent this whole time talking about legs, but PAD was never really about the legs. Let me just say this as clearly as I can. The problem is not just in your legs. What PAD really is a giant system-wide red flag. If the pipes are clogged in your legs, it is almost a guarantee that the same nasty plaque is building up in the arteries that feed your heart and your brain. In fact, the research is just stunning on this point. What this quote is saying is that having leg pain from PAD isn't just a sign of trouble. It's actually a stronger predictor of a future heart attack, stroke, or death than if you already know you have blockages in your heart or neck arteries.
Think about that. That pain in your leg is one of the loudest alarms your body can possibly sound.
So, we end up right back where we started. That simple ache, that cramp you might want to ignore, it's worth asking, not just yourself, but your doctor. Is this just a tired muscle, or is it something much, much bigger? Could that pain in your leg be your heart's last-ditch effort to warn you before it's too late?